And there was a different dose of apixaban used in patients that were above 80 years, weighed less than 60 kilograms, or their serum creatinine levels were 1.5 milligrams per deciliter or higher. So in this population, we are using 2.5 milligrams daily. The dose of aspirin, like I mentioned, was 81 to 324 milligrams, basically 1 to up to 4 81 milligram tablets that were basically just at the discretion of the local investigator. The investigators were also encouraged to discontinue any non-steady aspirin at the time of the randomization. And the patients that were on other antiplatelet agents like Plavix that were not originally enrolled or eligible for the study, but if there was an indication, then they could be prescribed. The inclusion criteria was patients that were above the age of 50. They had atrial fibrillation documented in the 6 months before the enrollment, or basically had a 12-week EKG done at the day of screening that showed atrial fibrillation. At least had one of the risk factors for stroke, which included having a prior stroke or a TIA. They were older than 75 years, had hypertension, and were receiving treatment for it, diabetes, heart failure.